Let's see an NCLEX-RN tips and points video on cardiac assessment. There are different laboratory predictors for cardiac disease or heart disease. The different types of laboratory tests we need to do and the normal value we need to know. First is about the lipid panel, which includes cholesterol, low density lipoproteins, high density lipoproteins and triglyceride levels. The normal level of cholesterol is less than 200 mg per dl and LDL value should be less than 100 mg per dl. The high density lipoproteins, it must be greater than 40 to 60 mg per dl. Triglycerides less than 150 mg per dl. So that's about the lipid panel. Next, glucose. It should be in the range of 65 to 99 mg per dl. Homocysteine level must be 4.4 to 10.8 mm per liter. Then C-reactive protein must be 0. C-reactive protein is only present when inflammation is present. Coagulation studies include platelets, fibrinogen levels, prothrombin time, partial thromboplastin time, and international normalized ratio or INR. The platelets should be within 1,50,000 to 4 lakh mc per liter. Fibrinogen levels must be 200 to 400 mg per dl. PT level must be 10 to 13 seconds. The partial thromboplastin time must be 25 to 35 seconds. The INR value must be less than 2. So this is about the laboratory predictors of heart disease. Next is laboratory markers of heart disease, which includes CKMB or creatinine kinase myocardial bands, troponin level, myoglobin and brain natriuretic peptide or BPN. The value of CKMB is 0 to 3 nanogram per ml. The troponin level must be less than 0.4 Ng per ml. Myoglobin level 0 to 85 nanogram per ml. BPN must be less than 100 pg per ml. There are certain post-procedure interventions, nursing interventions, which must be done after cardiac catheterization to prevent complications. This include maintaining the patient on flat bed rest for 2 to 6 hours to prevent stress on the insertion site, which may cause bleeding. Observation of the catheter insertion site for bleeding or hematoma formation. Cardiac monitoring and frequent vital signs monitoring. Monitoring the patient for chest pain. Assessing for signs of stroke such as confusion, weakness or slurred speech. Monitoring peripheral pulses, color and temperature in the affected extremity. Monitoring urine output secondary to the osmotic diuresis caused by the contrast dye. Maintaining sufficient oral or IV fluid intake to ensure renal clearance of the dye and to maintain adequate hydration status. Obtain blood work to assess the renal function, hemoglobin or hematocrit and coagulation studies. So this can come for select all that apply in NCLEX-RN question. Hope you understood this video on cardiac assessment of some points. Thank you so much. Please do keep watching.